right.
a little intro. Mo Auster is our Vice President of the Legislative and Regulatory Affairs of MSSNY, and an integral part of MSSNY's effect on the legislator bodies in New York. So you can take it away.
Oh, thank you. Thank you very. Just bring up my application. Well, thank you very much, everyone, for inviting me. And obviously, Dr. Mehta always in his presentations always has such inspirational topics to try and table set and kind of put our perspectives in the context of other struggles and us, and all of you in your quest to become better physicians and better advocates, and for everyone else, kind of how to approach all of our challenges. It's he always finds these great historical reference points that we can use to advocate. I certainly just want to begin by thanking you all for your efforts, for being here on a weekend day, and everything you do towards becoming great physicians, and also contributing to organized medicine with your efforts. It's really tremendously important, and I always highlight with everyone that you all can become great advocates. Many of you are already great advocates, but it is an investment over time. And it is something that is not just sort of a one-off thing and do it and then stop and then pick it up again 3 years later. It's about developing relationships, and you all, through what you do professionally or maybe personally, get to know individual legislators at various levels. And I think what's important is really kind of helping develop those relationships, because so much of what is debated legislatively relates to healthcare, and who knows more about that than all of you. So over time, you don't get everything that you want, but you do get a lot of what you're looking for, and then ultimately it's the result of your own credibility that you develop, that your colleagues develop with legislators. So I encourage you all to really stay focused on kind of that ongoing communication efforts. So again, thank you very much. This was certainly a very, there were a lot of successes this year and also a lot of challenges this year. For organized medicine, certainly we partner with a lot of different groups, a lot of other specialty societies, a lot of other patient advocacy groups, for both supporting and opposing key legislative items. I do want to highlight some of the real good successes that we had this year, before we talk about the challenges as well, because there were a number of very positive outcomes that happened this year. Talking about the state budget, we actually, after worked very closely with the Psychiatric Association and ACOG in support of legislation that will require health insurers to make telehealth payments equal to what they do for in-person payments. And we all recognize how important telehealth became during the context of the pandemic. And now it is a regular part of healthcare delivery. Certainly, particularly on the mental health side, it really was an increased way for patients to access care in an environment where they felt more comfortable. So it was very, very important to make sure that we are investing in that through many levels, including through appropriate payment. Also very important as well was a significant investment new investment in the Doctors Across New York program, almost doubling what had been the funding for the program, which provides up to $120,000 in student loan repayment relief for those who agree to serve in underserved areas for 3 years. So that was an important new program program that was reinvested in this year. And then Medicaid payment increases, moving New York's Medicaid fee schedule up to at least 70% of Medicare. Now, Medicare itself is not particularly great, but we had been at 45% of Medicare previously, and so it does provide some positive investment in the first step, maybe of, we hope, multiple years to try and continue to bring up New York's Medicaid fee schedule, and that is again very positive outcome. Important coverage expansion. Within the medical society, we have different perspectives on a single payer system, but I think what was very important, what all physicians agree upon is having opportunities for all patients to receive health insurance coverage, and not have to face and be able to get coverage that doesn't have excessive cost sharing requirements. And the state took important steps this year by bringing up the income eligibility level for the state's essential plan program to 250% of the federal poverty level, which basically helped make first dollar health insurance coverage much more accessible for those who make too much money to qualify for Medicaid. Other areas taken to eliminate cost sharing for a new income band for the Child Health Insurance Plus program, and also expanding Medicaid coverage for postpartum care 1 year after birth. Some targeted health insurance reforms as well, too, to respond to some of the concerns we've heard from physicians about delays in credentialing, about hassles, about health insurers making excessive medical record requests, and then highlighting an area where we worked very, very closely with our counterparts in the specialty societies. There was a proposal in the governor's budget that would have required physicians to have to pay upfront for the excess medical malpractice insurance program. 17,000 physicians get that coverage in the state of New York. Essential program for helping to provide a bonus layer for the excessive liability costs we face. The governor had a proposal that would have required physicians to pay upfront for that coverage and then be reimbursed by the state. And due to our collective advocacy, that piece was actually stripped from the budget. So very important. Turning to the end of the legislative session, right now, there's probably still roughly 450 bills that passed both houses of the legislature before June 2nd that have not been delivered to the governor. A lot of them are items that maybe are a little more, that there's strong arguments on both sides of these bills, and probably most of them are not going to get sent until after the election at this point. And so there's going to be a lot of back and forth in November and December over these bills, but certainly a number of them were very, very positive from the physician standpoint, including bills a longstanding bill that we've been working on that will help make sure that health insurers use qualified reviewers when reviewing pre-authorization requests and claim submission requests, by making sure that those reviewers are in the same specialty as the physician recommending the treatment. So we don't have an internist looking at psychiatric care, or we don't have a psychiatrist looking at orthopedic care, making sure that they're in similar specialties based upon similar types of care being provided. A couple other important bills. One would make sure that if a patient has a discount card to help offset the cost of prescription drugs, that discount can go towards helping to meet the patient's deductible. Some health insurers have tried to prohibit that, which we believe is completely unfair. And so this bill would prohibit what are called these copay accumulators. Also, very important, a bill that would prohibit health insurers from using step therapy or fail first mechanisms for treating various mental health conditions. We had worked on a bunch of years ago, we worked with several patient advocacy groups on a bill that creates greater guardrails around step therapy used by health insurance companies, and create processes for physicians to more easily override those fail first protocols. This would completely say you can't even use a fail first protocol for various mental health medications. So we're hopeful that that bill can be signed. This is just an example of a graphic that we created based upon a survey about health insurers inappropriately denying care where the reviewer is not the same specialty, and also some of the social media that we've been doing, which I know many of you have also helped to retweet, urging the governor to sign this bill into law. Just the press release we worked on with a number of patient advocacy groups in support of these various health insurer reform bills. We regularly work with the Bleeding Disorders Coalition, the Multiple Sclerosis Society, the American Cancer Society, and the Mental Health Association, helping to support each other's legislative initiatives as it relates to health insurance reform. And we think it's really been a very effective alliance of groups working together on shared concerns. And frankly, as we have our own limited advocacy resources, it's great to have partners who share similar goals that we can work on. Highlight a couple other bills as well that have passed both houses, MSSNY supported, requiring insurance coverage for colorectal screening tests being lowered to age 45, requiring health insurers to provide point of care information about formularies and patient cost sharing amounts, so the physician knows right when they're treating the patient what is covered by the patient's formulary and what potential cost sharing implications there are. And then also another bill we worked on with a variety of groups that would provide greater due process for when physicians and other healthcare providers are investigated by the Office of Medicaid Inspector General. Now, like I said, number of very, very positive bills passed this year. Same time, there are a number of challenging bills and some mandates as well, which I list here, but I think I want to focus most on, because Dr. Mehta mentioned it before, the wrongful death expansion bill. That, again, not just on physicians, it's on hospitals, businesses, municipalities. So it's a pretty wide swath of groups that are impacted by it. So it's a pretty wide swath of associations that have been working to urge the governor to veto the bill. Just basically about it is it would expand New York's wrongful death law, which is usually designed to cover economic costs for the inappropriate taking of negligent taking of someone's life, and expand the type of damages that are awardable to include non-economic damages such as grief, pain and suffering, and also to expand the eligible persons who can bring those actions. Right now, it's typically the spouse or the parent or the children of a deceased person, but this would theoretically expand it out to a much greater number of people who have a connection to that deceased person. So you can see why that would have such a significant impact upon liability premiums, where it's been estimated to increase premiums by 40%, which is just a staggering amount. Many of you may have seen this. This is our grassroots link where we've been encouraging physicians to send letters to Governor Hochul urging that she veto the bill. We've received a lot of physicians have sent communications. We are aware that probably about 2,500 physicians have sent communications to the governor, and there have been about 500 tweets as well, which is good. We have over 80,000 physicians in the state of New York, and I think we'd like to see a number that's at least 4 times that. If we have, we should at least have 10% of the physicians doing that. So it's a good number, but I think we want to have it be in such overwhelming numbers that that's really, really impossible to ignore. And so we certainly look to you all to kind of energize a whole swath of younger physicians in making these communications, because there are impacts on everybody. It's not just an impact upon those who are in their own practices, who are paying the premiums directly. There's also significant implications for the hospitals where they may be employed, because this is a significant amount of outflow of money that will be going out to pay for liability costs that won't be able to use for investments in providing care or salaries for their staff. So again, this is why it's important across the board, why we're encouraging physicians to send communications to the governor. Like I mentioned, we've been partnering with a lot of groups to try and help generate the veto, working very closely with Greater New York Hospital Association, Haney's, which are 2 800-pound gorillas in New York State politics. Because certainly, as you know, the hospitals are such a big employer in the state of New York, and really provide and certainly are important community safety nets, that if they're going to be adversely impacted, there's a significant consequence for all the communities that they serve. So we've been working very, very closely with them. Plus, it helps they have deeper pockets than we do. So they have been together. Greater New York Hospital Association and MILMIC have been helping to provide support for an ad campaign. I'll just jump ahead to this. That's called NotOneMoreCostHike.com. That's being organized by the Lawsuit Reform Alliance, where they've done ads in various papers across the state, the Buffalo News, the Daily News, AM New York. They plan on posting this ad in several other newspapers across the state, both in their print site as well as their online sites. mentioning as well, there are other groups that we've been working closely with: the New York Conference of Mayors, the New York State Association of Counties, the Business Council. This is an example of an op-ed on, opposing this bill that is from the New York Conference of Mayors. And then MSSNY has been doing a lot of media on this. Dr. Mehta's been everywhere on it. This was an op-ed that he did in the Albany Times Union. He appeared in Crane's Health Pulse, raising concerns of the bill. He and Troy Oshner, our executive vice president, were on Albany area TV station talking about the adverse consequences of this bill. And so we've been working with the county medical societies across the state to generate op-eds in other papers as well: Buffalo News, Syracuse Post-Standard, and they've already printed. We know they're going to appear in some other locations as well too. So those efforts will be ongoing. Turning topics as well, just to be aware, the healthcare worker bonus issue. I first got to say, and this just a great shout out to the residents across the state for their collective efforts in helping to ensure that when the program was rolled out at the beginning of August, that medical residents were included as part of the eligible employees for the bonus pool. We know that there was a large petition that was done by the residents because they were not specifically specified in the statute creating the bonuses, and that that was an important part of this, as well as efforts by MSSNY and several specialty societies. We did a group letter. We were in communication with the governor's office, with the Department of Health, about making sure that medical residents were included among those who could get bonuses. We also, in response to a number of questions, helped to clarify what happens if someone changes if their vesting periods end at March, but someone or March or September, but someone may change positions during the middle of one of the vesting periods, and how best to address that. They've been incorporated into the department's FAQ. Been a number of questions about this program that we've heard from physicians across the board about who's eligible, and there was ultimately clarification that it is for private physician practices. It's for those who have at least 20% Medicaid, although we are now working with the specialty societies to eliminate that 20% threshold, so all physician practices will be eligible to provide this for their employees. But again, I think this is sort of an ongoing effort. Since today is October 1st, the application portal opened up again for employers to submit claims or submit requests to provide bonuses to their employees for vesting period 1, vesting period 2. That is ongoing. This is just a list I put together for our physicians to because there's probably about 200 different questions from the department's FAQ, but to try and highlight sort of the top 10 items that physicians sort of need to be immediately aware about how this program is working. The only other issue, I know Dr. Mehta also talked about it briefly, challenges with CMS, and we're facing a pretty significant cut once again from CMS and our Medicare payments for 2023. Last year, MSSNY, working together with the AMA and specialty societies and state medical societies across the country, were able to convince Congress to do another 1-year patch to prevent those cuts. Well, it was a 1-year patch, which means those provisions expire at the end of 2022. And so we once again are trying to take significant efforts to urge our representatives in Congress to prevent this cut. Obviously, in New York, Senator Schumer will play a huge part in that. Everyone agrees that doctors shouldn't be cut for payments and for Medicare. The consequences of it, it's always a question of where do you find the money? And because they can't just, as much as we try and tell them, why do we have to find, pay for it? It's a congressional process of what they call pay for, which is if you're gonna allocate money, you have to find a way where it's gonna come from. So to prevent the cut from going to effect costs us billions and billions of dollars. So they have to be identified from some source. And as much as anything, it's lighting a fire under Congress to be aggressive in finding that offset. So that's why we're encouraging physicians as strongly as they can to also contact their members of Congress to ask these cuts work to be defeated. just to highlight one other item that as we are heading into an election, there's been a lot of turnover in the New York State legislature over the last several years. But there's going to be even steeper turnover next year, because in the Assembly, we are losing both the chairman of the Assembly Health Committee, Richard Godfrey, who was well known to many of you. I mean, well known for a lot of physicians, a lot of people know him as the sponsor of the New York Health Act. However, he was also the sponsor of numerous parts of MSSNY's managed care reform agenda, bills that would address pre-authorization hassles, bills that would provide collective negotiation rights for physicians, bills that would help protect against auditing abuses by health insurance companies. And he's leaving at the end of the year. And I think it'll be, when he obviously came to every meeting, he's Senator Rivera has, I think, kind of become that, taken on a similar role in the Senate now too, as Senate Health Committee chair. He's everywhere. Even though it's not, I know he went to the Brooklyn Medical Society's 200th anniversary. Even though he represents the Bronx, he's kind of everywhere in healthcare. So I think Senator Rivera kind of wants to step into that role, or step up his role there. But it will be a significant change that Godfrey is not going to be there. And also the Assembly Insurance Committee chairman, Kevin Cahill, lost his primary, and so he will not be coming back. So there's going to be a lot of musical chairs in the Assembly next year. So it's just something to be aware of, and kind of bring it back to where I started earlier, the importance of developing relationships with local elected officials, because the person who is the junior member, maybe they're a council member, maybe they're a city council member today, or maybe they're a county legislator today. They might be an assembly member or senator tomorrow. And certainly getting to know these folks at an early stage makes it even more important as they sort of begin to rise to the rank. So as I said, that's sort of my message to all of you, is to really work on developing those relationships locally, because advocacy is a long-term investment. And so it's just something that we really, strongly encourage, since you are all the future leaders of MSSNY. That will be tremendously important for future iterations of MSSNY, that you have these relationships. And again, once again, I want to thank you all for the opportunity to speak, and thank you all for the time you devote to MSSNY and advocacy, and for your patience.